We're going to have great health care, cross state lines. People can buy it. Will cost the government nothing. You'll go out. Private insurers are going to give you incredible health care.
Well, that was President Trump last night telling Fox News' Sean Hannity about his health care executive order, which he will sign later this morning. We're going to take you there live when he does it. The goal is to expand options for Americans by allowing them to buy insurance across state lines. Joining us right now is Steve Ubl. He is the CEO of PhRMA, that is the Pharmaceutical Research and Manufacturers of America. His group represents America's leading biopharmaceutical research companies, and it is good to have you on the program this morning. Thanks so much for joining us, Steve.
Thanks.
What's your take on this executive order, first of all, that the president's going to sign so that insurance can be bought and sold across state lines?
I think it's a good idea.
Yeah.
You know, I think we should be trying everything we can to lower costs for patients. You know, insurance design has really changed in recent years, where more and more patients are in high deductible plans, they're paying more out of pocket. So we have to absolutely make sure we're taking every step we can to lower patients' out of pocket costs.
And I guess the other piece of this is you want waivers to allow states to tell insurers in their jurisdictions you don't have to cover everything that Obamacare wanted you to cover. Is there hope that that might be part of this as well?
Yeah, I think states want flexibility to shape their insurance markets. Plans want flexibility to shape their benefits. And as long as we continue to make sure that patients have access to things like breakthrough medicines, I think that flexibility is a step in the right direction.
When President Trump was campaigning, he seemed to suggest, as Democrats have, that the government negotiate Medicare drug prices. Which they do not, which is actually against the law at this point. Has your industry been in discussions with the Trump administration? Because, again, the high cost of drugs, particularly new life-saving therapies related to cancer, they are incredibly expensive, and it is going to be it will need to be addressed at some point, not just for younger individuals in this country, but also older Americans on Medicare.
Well, we have had very productive discussions with the president and with the administration, and I think the president is focused on a few things. First, he understands that we lead the world in the development of better treatments and cures, and he wants us to continue to lead the world. Secondly, I think whether it's tax policy, trade policy, regulatory policy, he understands we want to level the playing field with our competitor nations to stimulate more domestic investment in the United States, more U.S. jobs. And finally, on health care, particularly with drug pricing, I think they want to enhance the competitive marketplace. And just to give you an example, hepatitis C, wretched disease. We now have a cure for that disease. There's now 3 companies in that space, and prices have come down by 60%. So we want to stimulate.
You want more competition?
Yeah, more competition is the best way to address it.
Yeah, another thing that the president did was he's trying to take a leadership position on this opioid epidemic. I want to talk about this. We were talking about it in the commercial break. Opioid, this epidemic in this country, responsible for the deaths of 91 Americans a day on average. This is at a cost of nearly $80 billion a year. The industry is talking about this more and more now, ready to help, backing a provision that would limit opioid painkiller subscriptions to a 7-day period. Typically, what do they give you? A 30-day period?
Well, it's hard to overstate the effect of this public health crisis. I mean, 64,000 Americans died last year of opioid-related overdose. So we need to be a part of the solution. And typically, our organization, our industry, really jealously guards the relationship between physicians and patients. We think healthcare decisions are best made through that relationship.
Yeah, so do we.
But in this case, you know, there's just too many patients who are getting 30-day supplies for dental procedures or minor healthcare procedures. So we want to take some bold steps to try to be part of the solution. So we did endorse a 7-day limit on opioids. We've also just initiated a public health.
But that's a huge burden on people who actually need opioids.
For 30 days.
Cancer patients in this country, where an individual has to drive 2 hours to get a paper subscription every week.
Yeah, we're not
from
talking about chronic
her doctor.
pain. These are just acute episodes.
Like,
an important point that you bring up.
Right, I've seen that. I've seen that with cancer patients, where it is a huge burden on them dealing with restrictions put on opioid prescriptions for people who are abusing them versus people who actually need them.
You make a good point. There has to be exceptions, but in general, again, we think patients are getting more than they need in these minor procedures and short-term pain episodes.
Yeah, and you said during the commercial break, when they run out of the opioids, they go to heroin.
I mean, this is a tremendous public health crisis. One of the other things we're trying to do is really bring our best and brightest scientists. The real answer to this problem is non-opioid alternatives. So our companies have 40 projects in the pipeline. We're partnering with NIH and FDA to try to streamline that process to get more products that are non-opioid.
A lot of this is driven by the Medicaid expansion under Obamacare, right?
I think that, it's not improved access to care that's driving the opioid crisis. It's a very complex public health problem, and we want to be part of that solution.
I will leave it there. Steve, good to see you. Thanks very much for weighing in this morning.
Thanks for being here.
Steve Ubl there. Coming